In the closing days of 2019, a new virus emerged in Wuhan, China, known as SARS-CoV-2. This novel coronavirus, invisible to the naked eye, was set to change the world in ways we could hardly imagine. From its origins in a bustling city of 11 million people, it quickly found its way into every corner of the globe. The virus hitched a ride on planes, boats, and trains, spreading far and wide through international travel. As the calendar turned to 2020, countries far removed from Wuhan began reporting their first cases of this new, mysterious illness. Unchecked, the virus spread rapidly from person to person, from city to city, from country to country. In what seemed like the blink of an eye, the world was grappling with a health crisis of a magnitude not seen in over a century. In a matter of months, this new virus had spread globally, marking the beginning of the COVID-19 pandemic. The health impact of the COVID-19 pandemic has been devastating. This microscopic menace, known as SARS-CoV-2, has spared no corner of the world, bringing healthcare systems to their knees. Hospitals, clinics, and health centers have found themselves overwhelmed, struggling under the burden of an influx of patients. This rampant virus has shown no mercy, causing high rates of illness and, sadly, death. From the young to the old, across all walks of life, the virus has left a trail of suffering in its wake. It's not just the physical toll. The emotional and mental strain on those affected and their loved ones cannot be understated. But the impact doesn't stop there. Our medical professionals, the frontline warriors in this battle, have seen their work and personal lives turn upside down. Doctors, nurses, paramedics, and other healthcare workers have faced unprecedented challenges working around the clock, often at great personal risk. They've had to make difficult decisions, juggle resources, and bear witness to the harsh reality of the pandemic, day in, day out. Their resilience and dedication are commendable, but this crisis has also underscored the vulnerabilities in our healthcare systems. It has exposed gaps and weaknesses and has made it clear that we need robust, well-prepared healthcare infrastructures. The pandemic has stretched healthcare systems to their limit and highlighted the importance of a robust and prepared healthcare infrastructure. Faced with a rapidly spreading virus, nations around the world implemented a range of measures to slow its spread. The most immediate and dramatic of these were lockdowns and quarantines. Businesses shuttered, schools closed, and households became isolated units in a bid to halt the virus's relentless march. Travel, the very thing that had allowed the virus to spread globally, was heavily restricted. Borders closed and airports fell silent as countries sought to protect their citizens from imported cases. Moreover, a new era of public health measures was ushered in. The sight of people wearing masks, once an oddity, became the norm. The term social distancing entered our everyday vocabulary, representing the necessary space we needed to keep from one another to limit the virus's transmission. These measures drastically changed our daily lives in an effort to keep us safe. A world on pause, adapting to a new way of living, all to halt the tide of a microscopic enemy. The measures necessary to combat the virus have had significant social and economic impacts. It's like watching dominoes fall, one after the other. With businesses shuttered and industries halted, countless jobs have evaporated into thin air. From bustling cities to quiet rural areas, the economic downturn has left no corner untouched. The ripples of this recession are felt far and wide, creating waves of financial instability and insecurity. But the tremors of this pandemic extend beyond the economic realm. Educational institutions around the globe have been thrown into disarray. Schools echo with the silence of deserted classrooms, replaced by the digital hum of online learning. This sudden shift has not only disrupted the academic progress of millions of students, but also widened the educational divide. Those without access to technology are left stranded on the wrong side of this digital gap. And then there's the social element. The basic human need for connection now stifled by necessary restrictions. The rhythm of life has changed. Birthday parties turned into Zoom calls, hugs and handshakes replaced by elbow bumps. The simple pleasure of a shared meal, a distant memory. The spaces that once buzzed with interaction and camaraderie now stand empty and silent. The pandemic has reshaped our world in ways we could have never imagined. But as we navigate through these tumultuous times, remember, it's the resilience of the human spirit that will guide us into a hopeful future. In an unprecedented effort, vaccines were developed and rolled out globally in record time. It was a race against time, a collaborative effort by scientists, healthcare professionals, and governments around the world. The goal was not just to find a solution, but a fast and effective one. These vaccines, created with various technologies, including the novel mRNA, have proved to be a game changer. They've been instrumental in reducing the severity of illness and hospitalizations. They've been our shield against the invisible enemy, the SARS-CoV-2 virus. While the journey to this point has been fraught with challenges, the speed and success of vaccine development and distribution is a testament to human ingenuity and resilience. It's a beacon of hope in our collective fight against the pandemic. As we continue to navigate the path of this pandemic, these vaccines are our best bet to restore some semblance of normalcy. Vaccines have offered a glimmer of hope in these challenging times. Despite the progress, challenges remain. The task of ensuring widespread vaccine coverage is a formidable one. It's like a global marathon, where every country, big or small, needs to cross the finish line. From the logistical complexities of distribution to overcoming vaccine hesitancy, it's a race against time and the virus itself. Yet, as we advance, the virus adapts. The emergence of new variants adds another layer of complexity to this ever-evolving situation. Each variant brings new questions about transmissibility, severity, and vaccine efficacy, reminding us of the necessity for constant vigilance and adaptability. Additionally, the ongoing monitoring and adaptation of public health strategies are crucial. As the situation evolves, so too must our approach. It's about learning, unlearning, and relearning as we navigate through uncharted waters. Indeed, the challenges are substantial, but they are not insurmountable. Navigating these challenges is critical to our global recovery. The pandemic has underscored the importance of global cooperation and solidarity. We're living in an interconnected world where a health crisis in one corner can rapidly transform into a global catastrophe. The COVID-19 pandemic has proven that no nation can stand alone in the face of such a threat. International collaboration is not just a choice, but a necessity. Countries across the globe have shared resources, knowledge, and expertise to fight against this invisible enemy. We've seen unprecedented levels of cooperation in the development and distribution of vaccines, in sharing data about the virus and its variants, and in supporting each other's healthcare systems. These shared efforts have taught us invaluable lessons about our collective strength and resilience in the face of adversity. They have shown us the path to better preparedness for future health crises. Together, we can overcome this crisis and build a healthier future. The future remains uncertain, but our resilience and solidarity give us hope. As we stand at the crossroads of a world forever changed by the COVID-19 pandemic, we realize the immense power of our collective strength. This pandemic has taught us that resilience isn't just an individual trait, but a global one. Our ability to adapt, to innovate, and to persevere has been tested like never before. Yet here we are, standing stronger and wiser. The rapid development of vaccines, the evolution of digital technologies, and the global cooperation we've witnessed all underscore the importance of innovation. They highlight the need for continuous investment in our public health infrastructure, in our research capabilities, and in our crisis management strategies. This is not the end of our journey. It's a new beginning, a chance to learn from our experiences and to build a safer, healthier world. As we navigate this ongoing crisis, let us remember the power of unity, resilience, and hope.